Hello, everyone. My name is Jyotsna, and we are starting this podcast that is healthcare IT, and we have a very special guest, Jeff, and he's the IT director. So before going the, we want to know about little bit of Jeff and your journey and picking you in healthcare and what initially drew you in this field. Can you please share?
Oh, sure. So my first foray into a healthcare setting with IT was back when I was in college, actually. And I got an internship at the local hospital to help them roll out their Windows 95 computers to all of the staff. So they were moving from a server mainframe workstation architecture to PCs everywhere. And the Novell server and Exchange server and some other things. So, so I started there, and after a few years, worked myself into becoming the system administrator. So I was in charge of the all of the Microsoft servers and backups and user accounts and all the fun details around that. But just make sure the architecture was all up and running um, and all that. So I don't know if I was really drawn to healthcare IT or if that kind of just started me off on that track. That's where I got introduced to. I think HIPAA got passed initially while I was there, so I got initiated into HIPAA. Uh, I had a couple of projects that I managed, rolling out a time and attendance software, brand new system for the entire company. Um, And I worked with the finance department, the lab, radiology, the emergency room. So I got a pretty wide exposure to how each of these different departments within the hospital work on, use the computers. And then eventually end up with the pharmacy inside the hospital. So then I got introduced to pharmacy specific needs and the Pyxis stations that dispense the drugs on the floors and um, a lot of those things. And then I actually went back to college and studied some other topics in physics and a lot of math because you take a lot of math for physics. Uh, um,
That
and then Yes, yeah. So then I and then I wasn't able to quite finish all that, but I basically took all the classes for a uh, computer science degree with a math and physics minor, and I was like two classes short from like a double major, physics and computer science. But had a couple of life changing events, so I was kind of got kneecapped in getting that all actually with the diploma. So I'm all the knowledge and no piece of paper to show it is kind of where I'm at.
yes, yes. Actually, it's very commendable that you have done so many things. You know, like we in your experience, you just want to know, in your experience, what are the most significant challenges in leading technology initiatives in a healthcare setting? What do you feel actually?
Oh, one of the key challenges in a healthcare setting is, especially if you're dealing with patient data, is keeping, especially in today's world, keeping that data secure. It's, I would say that's probably your number one challenge. Uh, there's lots of regulations, especially if you go international. There's a lot more regulations. Uh, and then just keeping the data secure is you read in the news, people you know, major corporations are getting hacked all the time. So,
Yes, yes. And okay, that's actually very great. And we know that we are living into a digital transformation, and like industries are using so many things of digitalization, and we want to know, like from your side, what digital transformation was a buzzword across industries, but what does it truly mean in the context of healthcare, and how our organizations successfully navigate this transition?
So, um, where I work right now, and have for the past 13 years, is in the pharmaceutical distribution type of space. Uh, when we first started the TrexAid platform, it was sort of a shift in direction, or a paradigm shift for pharmacies, for independent pharmacies particularly, um, to be able to procure, their prescription drugs and RXs and stuff to sell in their stores and prescribe to patients. So prior to Trexaid, they would sign up with a their primary supplier, eventually, sometimes not right away. And then in that case, that they had to rely on when they first got started, they had to rely on the secondary market, and it's a very tedious process to get an account set up with any of these suppliers, and you really can't order anything from them until you have your account set up. Um, and there was a lot of faxing documents back and forth, and probably even mail, or probably snail mail. Um, Uh, and then when they got set up with their primary, then because that was such a lengthy process to get everything set up, and even once you had that set up, you had no way to shop their catalog. You had to basically pick up the phone and call them. Uh, um, so what was happening is they would just order everything to their primary, and the primaries had them locked into these contracts that looked very lucrative to them, but they had no way to know if they were getting a good price, even with their rebates and everything else that was built into there. So when we hit the market, it provided uh, a few things. First of all, we streamlined the application process. So you could fill out all that information once. You could e-sign it. So that was the first move towards a digitization of the process. Um, and then that application worked for a handful of suppliers initially. And as the site grew up into the 40 or 50 different suppliers, so you could initiate an account. It might take you 15 or 20 minutes to fill out that first application and sign it, but you only had to do that once now. You don't have to do that 15 or 20 times in order to get access to their catalog. And then the second thing we did was, once you filled all that out and your account was verified, we did verify these were actual pharmacies signing up with us. But once that was all verified, you could log into the website. And now suddenly, rather than picking up and calling each of these suppliers and asking about the specific drugs you're looking for, now you can just see them and all the prices. And more importantly, you can see those prices compared to how much you're paying your primary. And a lot of pharmacies realize, hey, I can get some better deals. And not only do you see the products you were looking for, but you might see a great deal on a product that you're going to need, but you weren't going to actually order today. So you can take advantage of some of those really good deals on products, just because they were there. So, and then secondarily, I think the next shift that's occurring, even today, is a lot of the invoicing and shipping and ordering process. A lot of that is still um, fairly manual. So there's not a good connection between, like, they may have a computer sitting there with a pharmacy management system, but it's l- not very well connected to the suppliers, and not very well. And most of them do have like an ordering POS system, but none of the pharmacists really use those. So I think the next wave, and we're starting to see that now, is where the pharmacist POS, PMS, and POS system is more fully integrated into the ordering process, not just the prescribing process.
Yeah.
Um, yep. I and a lot of them have already begun or already have integrated the e-prescribing. So e-prescribing is where the doctors they don't write out the scripts anymore. They are just transmitted electronically to the pharmacy of your choice. So these independent pharmacies obviously need to catch up and keep up with the bigger pharmacies and be able to um, stay current as more of this stuff moves to a digital, as you mentioned, more of a digital flow of things. So that's definitely where I see the next big change that's occurring now, even actually.
Yes, yes, sir. Actually, everyone nowadays, everyone want to be like in a easier way. So yes, I also feel that we need to get into this digital transformations, and it's really helping us. So, and when we are discussing about digital transformation, we got this AI. See, because AI is a boom. Is like we want to like AI and automation are transforming many industries. How do you see these technologies affecting healthcare operations and patient care in the next few years?
So I think the adoption of AI in the healthcare setting is going to be perhaps a little delayed from other industries. Not entirely, but it'll be where it will be used will be more specifically in certain areas and not in others. I do believe. Um, I don't foresee AI taking over your role at the doctor's office, for instance, anytime soon. I don't think people are would be okay with that. Um, Even if the AI does a better job than your doctor of diagnosing you, I know people are not going to be okay with that. So that'll take some time to get into that area is what I feel. Um, Mostly the where AI is gonna enter into the field that I do believe is gonna be at the pharmacy level, alerting about, bad interactions with drugs, um, and then there's a lot of, difficulty around, pricing because you have, insurance, you have, rebates from this primary supplier, you have requirements on your ordering with your primary supplier in order to get those rebates. Um, and you have, there's brand products, there's generic products, and those factor into, your rebates as well. Um, and then your contract with the primary is very complicated, I would say. So that's one of the struggles that the pharmacies have now. That's why I think some of them are closing or selling out. Is it's really difficult for them to know, are they going to make any money this month? Uh,
Yes, I agree the same with you.
so I yeah, so I'm pretty sure that's probably going to be where AI enters into the picture first, to make some sense of the pricing and show these pharmacies, here's what you need to order from who, and here's why.
Hmm,
Uh,
sure. So, like looking ahead, what are the top technology trends you believe will define the future of healthcare in the next decade?
so yeah, technology in the next 10 years in healthcare. So uh, I think over 10 years, I will definitely see some AI move into. areas of healthcare that it's not now. I can see in telehealth, I can see AI getting used probably sooner than in your actual, um, office visits. Uh, I can absolutely see we're moving pretty quickly even now to a day where um, you grab your phone, you set an appointment with the doctor, you talk to them over the phone, through an app or on a video call. Uh, they they diagnose your whatever it is you have, and the amount of things they can diagnose, I think, is going to also increase that way. We have uh, personal medical checks that are more widely available now that you can do remotely that you couldn't do before, such as blood, the easy ones, blood pressure, temperature. We could kind of do those, but now it's moving into some other more diagnostics. Insulin levels and heart rate and oxygen level and so, a lot of those types of parameters. I can actually see a point where you can in 10 years, I can see where they could even run like a some some of the more simpler blood sample tests and process those right in your home and help these telehealth doctors be able to treat more diseases, more different sicknesses. And then, they'll send your script to whichever pharmacy it is that you would like, and that pharmacy will get the order, fill it, and send it on a courier to wherever you're at. You you'll have your app so you can tell them where you're currently at. It wouldn't have to necessarily be your home. It'll be your workplace of work, or at the grocery store, or in the Lowe's parking lot, or wherever you happen to be. So I really think I think that model is going to transcend a lot of the healthcare as far as patient care goes.
Yes, yes, sure. We are also looking for the better technology advancement in the healthcare, and yes, for sure. So, like we are discussing about the more healthcare and pharmaceutical things. So we want to know, like, Truxaid and PrimeRx has been a pivotal in streamlining pharmaceutical procurement. How do you see the role of technology involving in the space, and what innovations in Truxaid bringing you the table?
Sure. So the merger of Truxaid with PrimeRx happened earlier this year. And really it really came into a whole rebranding of PrimeRx. PrimeRx previously was pretty well known as Merchant, like merchant, like the merchant systems, rated. And they right around the time they purchased Truxaid, they were just beginning a rebranding of themselves to PrimeRx. Uh, and so they have now a PrimeRx cloud. So even there, we're seeing a digital transformation away from systems that run on computers in your pharmacy to just a browser-based, cloud based primary PMS system. Um, but anyway, they have the PrimeRx Cloud, they have PrimeRx Enterprise, and now they have what we've rebranded Truxaid into is PrimeRx Market. And the PrimeRx Market is positioning itself into becoming kind of the ordering piece for PrimeRx Cloud and PrimeRx Enterprise. Enterprise being the PMS system that's on the computer in the pharmacy. Um, uh, the ordering system in those systems either is not complete, I don't think, in the cloud. But despite all the work done in the enterprise system, it's still a piece of the software that none of the pharmacies really use. They've got quite a number of pharmacies, and there's just a handful of them that have ever even used the outer age range. So, uh, I think part of the strategic move there is the PrimeRx market is going to be the ordering mechanism for the PMS, for PrimeRx at least, PMS systems. So, um, and we're just about to, we have some new things to the site that we'll be rolling out soon that will make it even easier for pharmacies to uh, compare pricing. So they'll be able to compare the pricing with their uh, primary and the secondary market all in the same place. So, and if they have more than one primary, they'll be able to, be able to view the pricing from both primaries as well as all of the secondary markets that are on the market. And what that's going to do is transform ordering in the pharmacy to even one more level, because they'll be able to. So now they can kind of do that. So they have a computer set up and they've got a browser and they've got 5 or 6 tabs open. And if they need something, they have to switch between all the tabs and make sure they searched on each of those pages the same medication, and make sure they didn't typo anything. And even then, it's more, just it's just like calling on the phone. They're looking, one specific medicine, and then they're not seeing if there's a good deal on anything else at the same time, or seeing where they can save some money on something. So, uh, so this will allow them to put all the tabs away and only have to type in the information one time, or scan it in, or copy paste, or whatever. Um, and then they'll see not just the product they're searching for, but they'll see other similar products, or even just products that have a really good price, basically. And they won't have to swivel between the browser tabs and risk, you know, and as far as time goes, it might save them, a minute. But if they order 50 drugs a day, that's 50 minutes they've now saved. So it's going to be a time savings. It's going to improve their ability to save some money on their cost side. Um,
Exactly. Yeah. And we can say it's a hassle-free platform. It time saving plus hassle-free.
Time saving, more accurate, better, more,
Okay.
closer to costs and
Yeah. So we know like in every platform we face some challenges. So we want to know how does Succeed address the challenges integrating e-commerce solution within the highly regulated healthcare environment.
yeah. So some of those new regulations that you're referring to are like the DCSCA, which is in the industry known as track and trace. Uh, that's that's been talked about for a few years, and the implementation requirements have been delayed. But we're running out of delays. So here within the next year or two, that'll be a thing that is required. Uh, that we're already well positioned to support pharmacies with that. Um, so just briefly, that is a way for a product to be tracked from the manufacturer to the distributor, and then to the pharmacy, and then to the patient. So from the manufacturer all the way to the patient, there'll be a piece of data that basically tracks along with that medication, and it will tell you everyone had a part in that distribution process. So that's important, and it's coming out because, I mean, just like computer systems are being hacked, the medication, there's, counterfeit drugs, that enter into the distribution stream, and there's, unapproved, drugs that are still in the stream, and there's, uh, so to retain the health and safety of the patients, that are receiving these drugs, you need to make sure we know where this drug has come from. Did it come through a proper channel, or did it not? And then if not, obviously we don't, can't sell that one. But so that's really the crux of what this track and trace is. Uh, the next transformation that I'm seeing related to that is how this data is transmitted. So right now, if there is an electronic or digital way to transfer information regarding orders and shipments, uh, it's through a fairly archaic system known as EDI, which is still widely used all over the world for more than just one industry, more than just the healthcare industry. But it is a very old system, so it can't that system can't really support anything like track and trace. They've the first few phases of it, they were able to utilize some changes to the EDIs and do that, but then the final stage, that's not gonna be able to handle that. So there's uh, a new way to do some of that, which they have termed as EPSIS, EPCIS. So that'll be something that we are, moving into as well, and be able to, handle those files and share them or send them as we need. I also see a rise in third party companies that are handling the track and trace documentation and information that pharmacies will need to be have available. There's kind of a double move there, the underlying technology is changing to meet that requirement. And then there's these rise of these third parties that will uh, hold that data and try and retain it for audits and whatever else the pharmacies need.
Yes, it's good to hear. And like we are dealing in telemedicine and remote healthcare. These are the very growing sectors. So, how Trustset positioning itself to support these trends, especially concerning pharmaceutical access and distribution? Can you please tell us?
Yeah, so telemedicine is really going to be more on the patient and doctor engagement side of things. Where the pharmacy piece is going to come into play is in delivery basically of the prescribed medications. So even today, if you go to a pharmacy, uh, most independent pharmacies and a lot of the chain pharmacies, your CVS. I'd have to check that. I'm not sure if like the CVS and the Walgreens do that, but I know some of the smaller chains definitely do. But they'll do delivery even now, so they have ways to deliver your medicine. In most cases, it gets delivered to your house, so it's still kind of a analog kind of delivery process. Um, so I think as telehealth gets more adopted, and I know there's some companies already that are working on digitizing that whole prescription and fulfillment process, um, even today, so that your your medicines will be delivered to you wherever you're at. Um, so I mean, if you're traveling, you're not gonna be at home, so you're gonna talk to some different doctor that you're not seeing before. So an aspect of telehealth that's probably gonna have to be solved is, your medical record is gonna need to follow you, so that these doctors will have access to that. And that's probably where AI will start to come in because now the doctors are going to have to read these extensive medical histories for a 15-minute telehealth call, and they're not really going to have time to do that. I think AI is going to probably enter into the medical field. That's why I thought telehealth first, uh, because basically they can have an AI kind of like Copilot does, if you're familiar with that, in a Teams meeting. Um, the, if So what Copilot does, just briefly, is if you have a meeting in there, when the meeting is ended, Copilot will give you a summarized transcript of what went on in the meeting. Uh, so I can see AI definitely moving in the telehealth field and do kind of a similar thing. So your medical record you'll set up an appointment, you'll submit your medical record to the doctor, and then they'll have an AI on their side that will basically parse through your medical record and give the doctor a quick summary of what what your history is, and then he can better diagnose. Yeah, I can see that. I mean, the doctor would still be the diagnosing piece. The AI may make some suggestions, if your symptoms have been put in, but ultimately, it'll be a person still actually writing out, not really writing, but writing the prescription, digitally. Uh,
That a lack lazy, yeah. I'm also using so many platforms. There are so many things. And yes, as you said, if we are traveling, we can't go to the same doctor, and we use this platform where we can go online and we can just discuss about the medicines. As yes, and you said she AI use so many AI has so many questions. Like what kind of problems you are facing, what is your health condition, if you have a previous history, you uh, download it and save to the uh, the doctor will see first the data and they will recommend that he will just use the medicines. So, are you allergic? Any sort of medicine you are taking previously? What was the so these are the things. Yes, we are also facing it, and yes, actually, I feel it's a more time saving and using this platform. We don't have so many things to the doctor, and it's more easier for the doctors also go with the prescription, old prescriptions, and take it the concerns actually. So, so I think, uh, and we are discussing about AI, so I just want more AI things and data analytics. So, how Truxid is utilizing these technology to improve decision making and patient outcomes in the pharmaceutical supply chain.
yeah, so really, we fill a few areas there. The first one, so obviously, drugs that enter into the market don't always get sold right away, and they do have expiration dates. So uh, that that is one way that Trexate is helping in the distribution space. So we are able to get a hold of a lot of those short dated, expiring soon products. And then that's where these independent pharmacies find their best deals because usually those are discounted fairly deeply. So if an independent pharmacy has knowledge of needing to prescribe that medicine, within the next couple of days or weeks, then he's pretty okay ordering a drug that expires in 6 months or 3 months, and prescribing that. Whereas your WalMarts and these bigger chains, uh, they have big warehouses. You know they may move a lot of stuff, but they don't have any way to manage this particular drug expires in 3 months. We need to get that into the hands of a pharmacist to make sure that gets prescribed right away, so that it doesn't get wasted. So yeah, I think a reduction of waste in the pharmaceutical supply chain is definitely an area that the market will already does and will continue to excel. Uh, and then The other area is it just helping these independent pharmacies be able to meet a lot of the regulations, especially track and trace. Um, there's a lot of so like Medicare and Medicaid will only pay for drugs if they're from you know certain suppliers who are meeting various regulations on their side as well. Uh, So now pharmacies have to make sure when they order stuff, it's only coming from those types of suppliers. So TrexAid helps them do that as well. If they know that it's going to be a Medicare or Medicaid patient that's going to get the drug, they in order for them, I mean, they can get the drug and sell it to the patient, but then they're not going to get paid for it from Medicaid if it's not from the proper supplier or supply chain. So that's another area we will be able to help them. Um, I think I mean, it's probably a few more. That's the ones that come to my head right at the moment. It's a very dynamic field, so the regulations are changing. Some of these um, uh, accreditation systems are morphing or become merging or just new ones are popping up. Uh, and in the U.S. we have there's the United States, but the pharmaceutical and medical field is still very federalized. So there's 50 states, and there's state and local regulations that also get into the mix on these. Uh, I I mean, even and I see that getting more complicated in the coming years in the U.S., not getting less. So you have things like the controlled medications. So you got your prescription medications, and then you have the more closely controlled subset of those prescription medications, your painkillers and your you know some of these uh, drugs that can be abused, basically, is or they're dangerous in some way. Um, so there are certain different levels of control or requirements in order to distribute those, buy those, prescribe those. Um, and then each state, so there's the federal classification of that, but then each state is able to override the federal and make it more strict. They can't loosen a restriction, but they can definitely make it more strict. So that means now you have a drug that is just a regular RX in 27 states, and it's a Schedule 5 in 10 other states, and it's a Schedule 4 in 13 other states. And we're seeing a little more of that actually as uh, and I think that's because in different areas of the country, some of these drugs are getting abused in different ways, more so in some areas than in others. So that's why you're starting to see some of these localized ratcheting up of the control of the investigation.
Yeah. So, like, looking ahead, we want to know, like, in what kind of strategic technological advancement in truck speed focusing on to stay ahead in the healthcare marketplace.
Yeah, to stay ahead. So the key one, I think we talked about a little bit already, is a tighter integration as the ordering system for a PMS. Um, and obviously, as being part of the PrimeRx offering, there'll be a very tight integration there down the road. But that doesn't mean to the exclusion of everyone else. So there will still be not as tight, but there will still be some integrations with other pharmacy management systems. Maybe not to where that TruckState is the ordering platform for that particular farm PMS system, but it absolutely could be the ordering system that the pharmacy uses that uses that PMS system. Once the pharmacy is able to load all of their catalogs from all of their suppliers onto one platform, uh, it would be silly for them not to use that place to do their orders. Um, that is definitely going to drive most of the growth in the next few years at Trexaid. That in combination with we're keeping up with all the regulations. Once we have these catalogs, our next step is to kind of put in some AI and kind of help you. So now that we have all your catalogs, we know what all of your orders are, and now we'll be able to help automate some of your ordering. Maybe not fully, but we can definitely pre-populate a cart with everything that you've been ordering and say, here's what it looks like you've been ordering. If you need anything different, then add it in. But if not, you can just check out, and that will save them a lot more time. And
Yeah.
so I think, yeah, see where we're going. And obviously keeping out abreast of the track and trace laws and making sure that the electronic tracking of these drugs as they move around between suppliers into the pharmacy gets documented, and we will definitely be involved in making sure that piece of it gets completed as well.
Yes, sure. And thank you so much, Jeff, for sharing your knowledge and experiences and more ideas regarding the healthcare. So, anything else you want to say to the audience?
Well, no, I mean, just thank you for having me on. It's been a very nice discussion. I appreciate the opportunity.
A lot.
Yes,
Yes. Thank you so much, Jeff.
thank you.